Harm USMLE Question 1. A 60-year-old woman presents with a 3-month history of fatigue, tingling sensations in her hands and feet, and difficulty walking. On examination, she has a smooth tongue and hyperreflexia. Laboratory tests reveal macrocytic megaloblastic anemia with hypersegmented polymorphonuclear cells, PMNs. Serum homocysteine and methylmalonic acid levels are both elevated. Which of the following is the most likely cause of this patient's symptoms? A. Vitamin B9 folate deficiency. B. Vitamin B12 cobalamin deficiency. C. Iron deficiency anemia. D. Chronic kidney disease. E. Vitamin B6 deficiency. Answer B. Vitamin B12 cobalamin deficiency. Explanation: this patient presents with macrocytic anemia, hypersegmented PMNs, paresthesias, and subacute combined degeneration, characterized by degeneration of the dorsal columns, lateral corticospinal tracts, and spinocerebellar tracts. These are classic findings of vitamin B12 deficiency, which also causes elevated homocysteine and methylmalonic acid levels. This deficiency is often seen in patients with malabsorption syndromes, pernicious anemia, or those with limited animal product intake. Vitamin B12 deficiency can cause irreversible neurological damage if untreated. Folate supplementation can mask the hematologic effects of vitamin B12 deficiency, but will not prevent neurological damage. USMLE Question 2. A 45-year-old man presents with fatigue, glossitis, and numbness in his legs. His laboratory results show macrocytic megaloblastic anemia with hypersegmented polymorphonuclear cells. His serum homocysteine is elevated, but methylmalonic acid levels are normal. He has a history of veganism and limited dietary intake of animal products. Which of the following is the most likely cause of his condition? A. Vitamin B12 deficiency. B. Vitamin B9 folate deficiency. C. Iron deficiency anemia. D. Chronic liver disease. E. Vitamin D deficiency. Answer: B. Vitamin B9 deficiency. Explanation: this patient presents with macrocytic megaloblastic anemia and hypersegmented polymorphonuclear cells, which are classic signs of folate deficiency. The normal methylmalonic acid level helps rule out vitamin B12 deficiency. Folate deficiency can occur in individuals with vegan diets due to the lack of animal products and can lead to hematologic symptoms, but does not cause neurological damage. The elevated homocysteine is a hallmark of folate deficiency, but methylmalonic acid levels remain normal in folate deficiency, in contrast to B12 deficiency, where both homocysteine and methylmalonic acid are elevated. USMLE Question 3. A 40-year-old man with a history of chronic alcoholism presents with a 2-month history of fatigue, paresthesias, and difficulty walking. He has a smooth, shiny tongue and decreased sensation in his lower extremities. His laboratory findings show macrocytic anemia and hypersegmented polymorphonuclear cells. The homocysteine level is elevated, and the methylmalonic acid level is markedly elevated. Which of the following is the best initial treatment for this patient? A. Folic acid supplementation. B. Iron supplementation. C. Vitamin B12 cobalamin supplementation. D. Vitamin D supplementation. E. Vitamin B6 supplementation. And C. Vitamin B12 supplementation. Explanation: this patient's presentation of macrocytic anemia, hypersegmented PMNs, paresthesias, and elevated methylmalonic acid points to a diagnosis of vitamin B12 deficiency, which can be caused by chronic alcoholism, leading to malabsorption and other factors such as pernicious anemia. The elevated homocysteine and methylmalonic acid levels confirm the diagnosis. The best initial treatment is vitamin B12 supplementation, which can be given orally or via injection depending on the severity. Delayed treatment can result in irreversible neurological damage.